Gaysa Radio. Gaysa Radio, where you are family.
This is Livia from Gaysa Radio, and I'm speaking to Dr. Olarogun. Sorry, I hope I pronounced it right again.
All good, yeah.
And we with HART Fertility Clinic Cape Town, and this is our second interview, and we're talking about treatment options for the LGBT individual. Right, welcome, Doctor, and thank you again so much for your time. Doctor, the first question.
Thank you.
What are the treatment options for gay men?
Right. So in South Africa, we have quite a liberal sort of law regarding what happens with people in the same sex relationship. And if there are two, when you say gay men, you're talking about two individuals in a relationship together who wants to have a child, or one individual who wants to have a child. Are you talking about two in a relationship wanting to have a child in that relationship?
Well, are we talking about the gay couple first? The next question will be for the single man or woman.
All right, got it. All right, so gay couple. So, I think generally what we've done is, obviously, surrogacy is what you need to have. So you need somebody to carry the pregnancy.
All right.
So surrogacy in South Africa now entails for you to have a letter or a document from the High Court.
All right.
So you go to, and this cuts across whether you are in a same-sex relationship or not. If you want to do surrogacy at all, you need to go and see a lawyer, a fertility lawyer, which we have a few options in Cape Town, who then draws up a contract between you and the partner, and between the couple then and the surrogate.
All right.
So and then they then come and approach one of the fertility doctors, and then we say, this is the indication, this is the reason why we need surrogacy to be done. And then based on that, the court then approves and say, fine, you can go ahead with surrogacy, and then we go ahead and do surrogacy. Now, there are two parts to that. It could actually be a true surrogate. In other words, you're using a surrogate and using the surrogate's eggs as well. Okay. So the surrogate who's carrying the pregnancy is the one donating her eggs, and then one of the guys then gives sperms, and that's used to fertilize the eggs, and then she carries a pregnancy. Or you can use what we call a gestational carrier, where the woman carrying the pregnancy is just carrying the pregnancy for the couple, but then you get eggs from somewhere else. Oh, so you can get eggs from an egg donor agency or an egg donor, or one of the, so we have egg donors like that. So then that egg comes, and then we use the sperms, we have the embryos, and then we put it in a surrogate to carry for the couple. So those are your options, really.
And say now I'm a single gay man or a single gay woman, and I decide to have a child. What treatment options are there for me?
Okay, let's start with the gay woman first. That's easy, because especially if she wants to carry the child, the surrogacy we've spoken about already.
All right.
But if she wants to carry a child, then she needs to choose the sperm donor.
All right.
Often that you find that available in most clinics have a sperm bank. You can even go as far as doing it from outside the country. You can get sort of sperms imported, and then obviously you pay for that. And then we've got two options: either we'll do artificial insemination, where we make sure that she's ovulating or releasing an egg, provided her tubes are normal, and then introduce sperms at the right time and hope a pregnancy happens. Or we can do IVF, which is a bit more expensive, where we take the woman's eggs, fertilize with these sperms, get embryos, and then put it back inside her uterus. So that's for the single gay woman. Now, for the guys, again, you are left with the scenario similar to the one I had discussed earlier. So we need a surrogate, we need eggs. So it's in which order? Are you using the surrogate's eggs and her uterus to carry the baby, or the womb? or are we doing, you get egg donation and then, use the sperms and then we get another surrogate. So those would be the options. But all those things are legal, provided you follow the rules. They can all be done.
All right. So we basically, it's the same question then for a lesbian couple, but then they probably just have to decide which one will be carrying the baby.
Absolutely. Absolutely. And we see a lot of that. So they decide on who is going to be the carrier of the baby, and then they decide on where to get the sperms from. Like I said, it's available, and then we can either inseminate if the woman carrying the baby is the one who's going to use her own eggs, then we can do an insemination cycle. Then that's straightforward. But I often find that the one partner would rather donate the eggs, and then the other partner will carry the pregnancy. So we then take eggs from that partner, fertilize the sperms, and then the other partner then gets carried.
All right. And then what are the treatment options for a trans individual or a couple that has a trans individual in the process?
So when you say trans individual, can you make that a bit clearer?
A transsexual.
So going from one sex to another?
Yes. And they and our couple and they wanting to have a child. How do you work with that? What are the treatment options?
So it's a little tricky there because, it depends on, I guess, which stage they are at, when we're doing the process. So, for women who are probably transitioning into guys, if I'm getting you right, then it will be that we get the eggs already from her if she had made that decision earlier, and we can freeze the eggs. So that's always an option.
Nice.
We can, in that process, we can freeze the eggs. And then those eggs can then be used if she probably doesn't have a uterus at that point anymore. So again, we'll have to go surrogacy, blah, blah, blah. That can be done in that route. Mm-hmm. If it's the other way around, you can also freeze sperms at the beginning before the process, goes far down the line. Because once you completed the transition, then it becomes a little bit tricky because the gonads are often removed.
Yes.
During that process. Right. So if we get gametes or sperms and eggs at the beginning of the process, then we can use that. But once you remove the gonads, then there's no way we're going to get those. We're not going to get those gametes anymore. So it then becomes a bit tricky.
To me, how does the artificial insemination? How's it done? Just give me a brief outlay for all of us out there.
Okay, sure. So within artificial insemination, what it entails is basically introducing sperms that are washed and prepared in the laboratory. Yeah. So we take whether it's donor sperms or whether it's a person's sperms, but you will get that specimen, we wash and prepare it, and then introduce it into the uterus of a woman who is ovulating at that point. Okay. So at that point, if she's, and there are two ways we can do it naturally, where we wait for ovulation to happen naturally, and then introduce the sperms. But the proviso is that the tubes must be working, because if fallopian tubes are blocked, then you cannot really do IUI. It becomes a bit, impossible to do that. So, but if the tubes are normal, then you introduce the sperms into the uterus when she's ovulating and expect fertilization and implantation to happen. So the typical process will be, give some medication to try and get her to ovulate. We monitor the woman to make sure that she's ovulating at the right time. And at that particular point, we then introduce the sperms that are washed and prepared in the laboratory into the uterus and hope fertilization happens.
Right. And is IVF the same as artificial insemination? Or
No, it's completely different. It is different. So IVF is in vitro. The main is IVF means in vitro fertilization. So in other words, fertilization takes place in the laboratory, outside the body.
Right.
So we need to get sperms, we need to get eggs, whichever way we get those, whether it's donor or individuals or whatever, and then fertilize in the laboratory. Okay. Then we have embryos. So once fertilization takes place, we have embryos which usually we actually transfer them on day 3 or day 5, depending on what we're doing at that particular point in time. So if it's in a fresh cycle where we've just obtained eggs from the woman, then usually day 3 or day 5, after we've obtained those eggs and fertilized them, we go and put them back in the uterus. So the big difference is in IUI, you're putting the sperms in the uterus, expecting fertilization to happen in the woman.
Naturally based.
And implantation. Yes. But in IVF, that process happens outside the lab, in the laboratory, and then the already formed embryos are put back in the uterus.
So interesting, really it is. Are there any alternatives to the IVF drugs that you guys prescribe to get ready for if you have IVF done? What kind of drugs or alternatives can the people use?
So IVF, it's based on the proviso that you need to get enough eggs. Because if you're doing IVF and we're getting 1 or 2 eggs, the chances of success with that is often quite slim. And it's quite expensive, so you don't want to spend all that money hoping to get 1 or 2 eggs. You want to spend that money hoping that you will we aim to get between 5 and 15. And then try and fertilize. So the injections, we often use injections for that process. So a standard IVF cycle will be injections usually for about a 10-day period to stimulate the eggs. And these are, what we call gonadotropins. Those are the injections we use. Alternative would be to use tablets and a little bit of injection, but at that point, then you're aiming to get less eggs.
Okay.
So which is like I explained at the beginning, that's not what you really want.
No, true. But is it, for instance, everybody's on the herbal route and so forth, but anything that they can take just to prepare them before you start with the medicine and so forth?
So a healthy lifestyle is good. So in other words, if you're smoking heavily or you're drinking heavily or you use recreational drugs, we advise that you try and limit or cut that all out to try and keep the system as clean as possible. You should be on folic acid, always good for the woman because you're carrying the pregnancy, that always helps with multivitamin folic acid. But generally, it would just be a healthy diet, vegetables and nuts and stuff like that. Nothing really herbal that will make a big difference. So it's just lifestyle changes and all that could make a difference. And if the patient is overweight, both partners, you want that to also get under control as much as you can. Yes.
Oh, that's interesting. All right. And so now the patient comes to you and they really want a baby, but they're HIV positive. Is there a way that you can help them that it doesn't get transmitted to the baby and so forth?
Yes, all the time. So if you have an HIV positive couple and they are on antiretrovirals, which most people in South Africa are on, and the viral load is already very, very low. So in other words, the viral load is undetectable. Excuse me. The chances of actually transmitting that in any of the things we do is very slim. If you're doing IVF and doing ICSI, the transmission rates are almost zero because the gametes themselves that you're fertilizing with don't actually carry the virus. But the semen does. So if you're doing an insemination cycle and you're putting semen in the other couple, you then worry about transmitting to the other person if they are not both HIV positive. So, that's the first scenario. But as far as the baby is concerned, babies actually do well once the mother there's no viral load in the mom. The chances of transmission to the baby is very slim.
So interesting.
So it's so it's almost impossible to actually. And then you can then discuss with the obstetrician if you want to have a cesarean section because that also further decreases the chances of the baby being exposed to HIV. So the chances in this day and age with the modern medicine, the chances of actually transmitting to the baby is quite slim, very slim.
I'm learning a lot today, I must say. Another thing is, we watch a lot of these sci-fi movies and so forth. Now, say now I have a genetic disorder in my DNA and I want to have a baby. Is there a way that with science and new medicine that you guys can remove that in the DNA structure or how?
Not necessarily remove it. Unfortunately, what often happens is that if there's a genetic malformation in the man, for instance, it often gets transmitted because you're going to be mixing those genes with the genes of the female.
That's correct. Yes.
And it doesn't necessarily mean that that gene will be transmitted directly into the fetus, but you don't know which one is unless you check. So what we then do is, after we get embryos, we actually do what we call pre-implantation genetic diagnosis. So we take cells from those embryos. So you say you get 5 embryos, then you send cells from each one of those and check which one of those babies actually have, or which one of those embryos actually have the condition.
Yeah.
And then you make sure you don't put that one back. You put the ones that don't have the condition back. So that's about the only way one can perhaps try and prevent transmission. The problem, though, is if you then find that all the babies then have the condition, what do? Then it becomes a tricky one.
It becomes a very big tricky one. But it's so interesting to know that we're still not that succeeded to change a whole DNA sequence.
No, not quite.
Movies are too much lately. All right.
Absolutely.
Our law in South Africa, what does it state for same-sex couples when we want to start a family? What do we need to do?
So it's very liberal in South Africa. Thank God for that, because in other parts of Africa and some parts of the world, it's actually not as liberal at all. It's an issue. So my advice is always to make it official. In other words, I'm not saying necessarily get married or not, but at least have a document that says how this baby is going to be. If things fall apart later on, who cares for the baby that is coming out? So the advice is always go and see a lawyer and drop a contract just for the sake of the baby involved, not necessarily for the sake of the partners.
True.
Draw that, get some document that covers that baby, so that if 2, 3, 4, 5 years time, you guys are not together, who's going to take care of the baby? Where does the baby go? So you've already given that bit of thought. Like, you can argue that the same applies to heterosexual couples, and you can say, but perhaps a bit more difficult if it's a same-sex relationship as far as the child is concerned. And then you want to perhaps, see that. But legally, it's not an issue. So we have, same-sex couples that walk into our offices all the time, and we're able to treat them. We're not limited to what we can offer. But it's always good to get like a lawyer's letter or a document that has a background to it beforehand.
Right. And what happens if there is a medical complication? So now there's something that goes wrong with IVF or in vitro or so forth. What happens?
So you mean during the process or before the patient? So during the process of us doing the IVF?
Maybe after it.
So after during early pregnancy, is that what you mean?
Very early, yeah. Something like that.
Okay.
When you've just done the IVF and maybe a week or two later, something happens.
Right. So the scenarios are, you might over-respond. So sometimes when we treat patients and we're trying to get eggs for IVF, they respond a lot more than they should, which could sometimes be dangerous, called ovarian hyperstimulation. Mm-hmm. With that, we try and avoid it in the process of setting up the cycle. But if it does happen, then we might not transfer the embryos and start a pregnancy and just wait and freeze the embryos, mm-hmm. and allow her to recover before we put the embryos back. Mm-hmm. In early pregnancy, the chances, once you get pregnant, and if you were not hyperstimulated or overstimulated, then things usually go okay. The complications that can then happen, in early pregnancy could happen in any early pregnancy. So it could be something that could happen if you had conceived normally. So bleeding, early miscarriages and stuff like that. So that can happen. And obviously then you will follow the normal lines of managing that. So we will still be responsible as fertility doctors in the early parts of the pregnancy. But if it's later on, then your antecedent doctor will then take care of that.
Right. And say now we've had now a baby, a couple, and same-sex couple. We've decided we want another one. Are there any limitations in having more than one, or
No.
not at all? So we can just come in another one and off we go.
Especially if you got embryos from the first. So remember when we were talking about IVF and stuff, we're making a lot of eggs, and often we get a lot of embryos.
Right.
Often, not all the time. And we will then normally we'll put 1 or 2 embryos back each time.
All right.
Which means that if what we had available was 5 or 6 embryos, then we've frozen those for that couple. So it's always it's frozen. You pay a freezing fee, but it's there. So when you come back the next time, you're not going through that whole process again of trying to get embryos. The embryos are there. We just then implant them. So yeah, there are no limitations to numbers, but it could be the first one is usually the more difficult. Usually, going forward from there, it's actually easier.
So I'm learning so much today. Right. What happens if a same-sex male couple decides to have a family, but you guys, you as HART Fertility Clinic, do tests on us and find out that we have weak sperm, or what we normally call slow swimmers? What happens?
Yeah.
What is the option?
So the options are, in the same-sex situation, you're still looking at IVF, surrogacy, and all that anyway, like we discussed earlier. And it really doesn't affect, what we do. In other words, if there are still swimmers, so when you produce a semen, there are a variation of sperms that you get. Some of them are quick, some of them are abnormal, some of them are normal. So often we find 1 or 2 that we can work with. And that's what you need, because we do what we call ICSI, which is injecting the eggs that we get directly with the sperms. So the sperms are injected directly into the eggs and you get fertilization that way. The worst case scenario is perhaps no sperms at all being produced. And in that scenario, it's unusual that both partners will have that anyway. But say you have a situation where that happens, then you might be able to get sperms from the testes. So we might have to go directly to the testes and do a testicular biopsy and get sperms from there. And then we'll be able to work with those. But in some situations, there are no sperms being produced at all in the testes. So then that's the worst case scenario. And then you're looking at maybe using donor sperms as an option for, in that scenario. So those are all alternatives that are available, to be used by, by same-sex couples as well.